Hey everybody, this is Dr. Ben Pearl with FitFoot U. So today I am playing the patient, or not playing, but am the patient. I've got a right hip and right ITB issue that's been plaguing me. Soccer is probably the primary impetus for this. I also, though, had some issues. Recently I did a hill riding and I felt like a little quad pull up in here, which is relevant. So it's ITB, which is this stripe right down here on your pants, the seam of your side seam of your pants, radiating achy down to, this is the fibula, and there's a little nerve that wraps around here. I'll get some radiating down there. But then it also goes not quite to the groin, anteriorly. We call this the iliopsoas region. And I think I also have a little bit of a piriformis syndrome that is not the primary culprit, but then plays into that whole constellation. So, Carrie, hyphenated last name, with what's your last name that you use?
Is Webb.
Webb.
Yeah.
With Resurgent as the lead therapist here at Resurgent Therapy, and she's graciously taking me on the Cook's tour and treatment today. So,
Yep.
what would you
My
like?
job to figure it out.
Yeah. What
All right.
what lead questions do you have? Or
Okay, so we'll stop that though. 'Cause
okay.
I gotta.
Yep.
I gotta.
Yep.
All right. So with these kind of symptoms, what I need to do is to rule out anything from the lumbar spine, hip, and pelvis. So I'm going to take Dr. Pearl through some of these tests, and we'll see where the pain shows up. Okay. So I'm just going to look at you first with your alignment. Stand here. So you can just stand naturally. I am just looking. Okay. And then turn that way for me. Oh, your feet are a little overpronated.
I'm podiatrist.
Is that why you're a podiatrist? Okay. And then turn again this way. Yeah. Got a little extra there. Okay, so I'm going to take you through a bunch of low back tests, and you tell me if your symptoms increase, decrease, or stay the same.
Yep.
Okay, so go ahead and bend forward and touch your toes. Good, and then come on back up. And again, just tell me, do you feel anything there?
I have a little lumbar stiffness. I got kind of my back ribs on the soccer thing, so that's why that's a little sensitive, but not usually.
Okay.
Yeah.
And then bend backwards.
So I'm a little limited there, probably.
There you go. But any symptoms?
No.
Okay. Side bend to the right. Yep. And then to the left.
Only because of the rib injury, back ribs here.
Okay.
That's just
but
recently.
Still feels a little tight.
Yeah, a little bit. Right.
Okay. But nothing in the front of the hip or
No,
the side.
no, not at all.
Okay. Twist to the right. Without your pelvis. So I'm gonna just hold your pelvis and you twist your upper body towards the wall. Yeah. Keep going. Keep going. Good. Checking for symptoms. And now to the left.
Nothing.
Good. So that's some standard lumbar spine screening. Now we're going to do some quadrants. So what you're going to do is reach towards the outside part of your left foot. So bending forward and reaching out to the left with both hands. Yep. So you're going to flex and go left. There we go. And you're looking for those symptoms. Anything there?
No.
Okay, come on back up. And then right. Good. Come on back up. Now take this hand and slide it down the back of this leg. So I'm just closing the gap on some of these facets of the spine.
You want to do?
Yep.
Okay.
Extend and twist.
Okay.
And just seeing if there's any pinched nerves that can be creating any of this. But you feeling okay there?
Just tension, just tightness. Okay. Yeah.
None of the hip stuff.
No.
Okay. So that's a pretty clear lumbar screen. We're going to do some tests on the table a little bit later, but so far so good. Now I'm going to check your pelvis. So I want you to lift your right knee to 90 degrees. Yep. And then down. And then left, and then down, and then now side bend right and left. So back and forth. Yep. Okay. Everything good so far?
Yeah.
Okay. All right. So now you can face towards me. We'll do some functional tests, and you're still looking for the hip stuff. Okay. So the first thing you'll do is do a squat. So get as low as you can go. Keep going. Keep going. Good. Do you feel anything in that hip there?
No.
Okay, let's try one more time. All the way down, all the way down. Good. Still good?
Yeah.
Okay. Now I'm going to have you stand on the left leg, and I want you to do 3 single leg squats.
These are a little. I got a little snap crackle pop because of
Sure.
the meniscus.
Yeah, let's see
So
it.
yeah, I'm feeling the crunch. You'll crepitus. So I'm
Feel
kind
it.
of guarded
Yep.
to do that. Just feel that pop.
Ooh, I got you.
Yeah, I got some
Yep.
meniscus
Okay.
cartilage.
Okay.
Issue.
So that's already telling me you're going to be offloading onto the other
Of
side
course.
quite a bit, like playing soccer and those types
Right.
of things. Okay.
Right.
So let's see the right side. Yeah, so a lot more confident on that side. Okay, I see what you're saying. Good. Any pain with that? Okay. Now, can you do a squat where you're basically sliding your foot back like that? So it's an assisted squat on that left side, or still a little dicey?
Yeah, a little. Yeah, if I slide, yeah, a little
Okay.
bit. I mean, feel a little pop. Yeah,
Okay, you can do a little bit there.
yeah, a little.
Okay. All right. So now I'm going to check your calf, so down below. So you're going to go like this to the wall.
Okay.
And I want you to stand on the left leg and go up and down.
Right.
Yep. You're going to go 20 of those and tell me when you start to feel fatigued in that calf.
Well, you have the whole solar system at home, apparently. According to you, it's. Are you living in a tiny house? It's half the bedroom.
Good. See, it's
I'm getting a little more
tight.
poppy now.
Yeah.
See, it's good. It's more poppy, so maybe I.
Got you.
Because I'm noticing it popping on each one.
Okay.
I could still go through fatigue a little bit, but
Okay. Let's try that right side.
it's my perineal, I think, was popping.
Gotcha. Trying to keep this knee straight and just going up and down with that calf.
Yeah.
Yep.
I do have like an easy spin this afternoon, like not hard, so. Yeah, that's perfect.
Good. Okay. Yeah.
And
Sounds
it was a little
fatigue.
fatigue, yeah.
Okay.
A little bit.
Any hip symptoms?
No.
Like that?
No.
Okay. So this left knee is very interesting. We're really trying to get away from it. I see that. So because you're playing soccer, we'll do a few soccer-specific tests too.
Okay.
So I want you to just try to do some double leg hops on both legs.
So just.
Yep.
Just bouncing.
Yep. Yep. And you're checking for hip symptoms or pain actually in the left knee or anything
No.
like that.
No.
Okay. Try to run in place. Good.
Yeah.
Now lateral hops back and forth as if you were basically like, yep, side to side.
Good.
Good. Okay. And now just cutting. We'll just do that in a small area here. Yep.
Little popping here on this left.
Okay.
Yeah.
Okay.
Each
So,
one is a pop actually as I.
does it hurt at all?
No, I feel the pop on each
Okay.
one. Yeah.
Definitely don't trust it on the left.
Well, I trust it, but I know it's gonna pop.
Yeah. Okay. But
So I
no
don't-
pain
No,
on the left knee. Okay.
popping.
Okay. All right. So the other thing I want you to do is see if you can tap to the side and just see if there's any popping at that level.
No.
No,
No,
but as soon as you
that,
start to
and then-
shuffle, yeah. Okay. So just getting a general idea, not taking you on a soccer field right now, but just sort of your side-to-side cutting movements on both sides.
Yep.
Okay.
So this is a closed chain dorsiflexion test. It's really important for all athletes. It can actually affect the chain up to the knee and the hip. So because of the soccer history, I want to make sure that Dr. Pearl has sufficient ankle mobility and not affecting his hip.
Sure.
So the test is at 10 centimeters from the wall, keeping the heel down on the ground and then trying to get the knee to the wall. So you at 10 over there, or is the
think
heel
so.
popping up? Yeah, so come up a little bit more, probably to 8.
I think that's 8.
Yeah.
Wait. Yeah. That's it. Yeah, 8.
Okay. Good. So that looks about right. So that's on the right side. Now let's try the left side.
8?
Yeah, I think start at 8.
That's always fun. You were working with it.
And then let's see if you, oh, that's already popping up, huh? Yeah. So a little tighter on that side. Not surprising the ACL side. So go ahead, try to 6. Ooh, big deficit here. So maybe go to 4.
I did 5. I'll try 5.
Okay, try 5. It's very competitive. Okay. And then we got 5 there. Yeah. So 5 on the left and then 8 on the right. Okay, so now we have to make sure that the symptoms aren't coming from your back.
Okay.
So in this region, we'd be looking at L2, L3, somewhere around there. And so I'll be doing reflexes, sensation, and our myotomes. And just to make sure that there's no contribution from the low back, rule that out and move on, okay?
Yeah.
All right, so here we go. So I'm gonna have you lift your knee to my hand and then hold. Let me know if there's any pain, okay? Here it comes. Ooh, hard to do.
Little lumbar, but that's because of the soccer thing.
Okay.
But yeah, not bad.
Okay, so that one's a lot stronger than this one. Let's try this one again.
Yep.
Hold, hold, hold.
Yeah, you're right.
boy.
Weaker.
Yeah.
Yeah.
Okay.
Maybe bracing, something.
Let's try the quad over here. I'm gonna go medium just to make sure we don't get any of that
Right.
grinding
Right.
crepitus. Okay, hold here. Ready? Don't
Yep.
let me push. Okay, I feel that a little bit. And then don't let me pull. Ready?
Mm-hmm.
Good. And you can also see how this quad's a lot bigger than this one. You see the
Yeah.
girth of that? Okay. So because you're feeling some radiating pain that's a little inconclusive, whether it's soft tissue or whether it's coming from the nerve in your back, we actually have to rule out the nerves from 2 different ways. One, from a localized lumbar spine radiculopathy, which in this area is going to be L2 to 3, but also a peripheral nerve called the femoral nerve that comes right down the front of the thigh that can also be involved. So far, the lumbar spine is ruled out. So something we noticed is when we do this hip external rotation test, this looks nice. It's 45 degrees. You're a little limited here in internal rotation, what we're just noting. And here, there's definitely some hesitation. It's getting a little hung up as we go into the ear.
Yeah, I'm
right
almost, I don't know if it's the ITB,
Yeah.
hanging up along near the greater trochanter, or if it's something else.
Where do you feel it at?
Like I feel some
The
tension
lateral
in here.
part.
Lateral.
Okay.
Yeah, up at
So
the
let's try an internal rotation. It's tight too, but it is tight on the other side.
Yeah.
Do you have any pain there?
It's starting to mount some pressure
Okay.
here. Yeah.
Okay. So some positive hip tests. 3 tests specifically for your hip. This first one, and you just tell me if you feel any of the pain, okay? This first one is called favor, so we're gonna take this and then just drop the knee, and you can see how much tighter it is than the other side, and there's
Like a little twinge.
I can see there's a little pain there. Where do you feel it? Is it hip? Is it SI? Is it
ITB.
ITB. When I push it a little further, what do you feel?
Now it's coming a little tightness in the iliopsoas, but I wouldn't say pain.
Okay.
Yeah.
So definitely a little positive there. And we can see in the video, his other side has full hip range of motion, and this one is really tight. It was also tight into hip abduction. We stopped there. The other side has a good 45. So we're seeing a lot of hip positives here. I'm gonna go into fader, which is an impingement test. So let me know if you feel any pain there.
Sure. Little twinge in through here, right through here. I don't know if you know.
Yeah. So a little positive
Yeah, a little twinge right
on
here.
fader. These hip tests are lining up to be positive. And then the last one is scour test. So looking for some hip labrum lesions or injury to that area inside the hip joint. So it's a little bit of internal rotation. And first of all, does that motion hurt?
You know, as you're coming around this rotation on the clock,
Yeah.
a little twinge.
Okay. So that's not a positive scour yet because I haven't pushed into it.
Yep.
But I'm noting you have a little discomfort there. Now I am going to push in and
Okay.
see what we've got. Do you have any pain as I'm pushing?
Just a little tight. I wouldn't call it pain. Just a little tight. Maybe right through here, just a little as you're
Okay, so let's go through the
11
range
o'clock
again.
or
Yeah,
1
this is-
o'clock, 1 o'clock on the face. Yeah.
Gotcha. So we'll look at the range first. Does it hurt right there?
Just a little bit of something right
Okay.
there. Yeah.
When I push down into it, does it increase it?
No.
Okay,
no,
so
no.
typically this would look like a positive, but it's not actually. It's more that he's getting hung up on the range piece of it versus a true scour. Okay, so we finished all of our testing. We ruled out a lot of things and certainly ruled in specifically the hip. So your lumbar spine was good, the femoral nerves were good, but the hip was positive on a lot of the tests. So what you have is a hip impingement on the right side. You've lost a lot of range of motion in that hip that can be restored. So that's the positive, great news.
and then you won't feel that pain anymore. But the key to your entire case is that you need to be able to better load your left leg with this past history of your ACL and mastectomy. So when you're playing soccer and hiking and doing all these active things that you, even biking by the way, that you are creating a symmetry between these two legs and not overloading that right hip.
One quick question before you tell me what to do at home. How did you determine that there's no arthritic component or mild arthritic component, or is that still up for grabs?
In the right hip specifically? So in the right hip, it'll show up as a capsular pattern, so there'll be certain range of motion restrictions that will show. You have a little bit on both sides based on the limited internal rotation, but nothing I'm overly worried about in that hip. Also, there'd be a little bit more of a crepitus and deep pain within the hip itself, or possibly some groin pain, and that wasn't there today.
Okay. So what do I do at home?
Okay, so what I'm going to do is give you a list of things to start with. So in our phase 1 exercises for this approach, what we need to do is release that psoas or hip flexor, because that was really, really tight and tender. And then I'm going to give you some hip mobility exercises, especially with a band, that will really help actually stretch the joint itself and create some space in there.
Well, thank you, Carrie, for doing
Yeah.
this. I have
You're
confidence that
welcome.
you're going to get me back on track.
Okay, sounds good.